Welcome to BW Healthcare World. This is Harbinder Narula. SRL Diagnostics is one of the largest diagnostic chains in the country, with hundreds of laboratories conducting millions of tests every year. Today, I speak with none other than the person at the helm of its leadership, Anand K, who is the CEO of the SRL Diagnostics. Welcome to BW Healthcare World, Anand. My first question to you is that how has the diagnostics landscape changed post-COVID? Do you think more people are now going in for screening with the intention of prevention than the earlier prescribed tests by the doctor after becoming sick?
Yeah, that's a very good question, Harbinder. Basically, what has happened post-COVID is that there is an increased awareness about health and also about the role of diagnostic tests. The awareness has also increased on this fact that tests can actually give you more information on your health. So what we used to see earlier on uptake on preventive healthcare checkups, those have definitely more than doubled compared to pre-COVID times. So we are seeing more and more people being aware of their healthcare requirements and trying to check their immunity status. They check their vitamin status. They want to check their depending on their age, they want to decide on whether what is the kind of test they should take. So there is an increased awareness. And there is an awareness about where they should go and get these tests done. So we also see that earlier they would choose any neighborhood laboratory or any neighborhood hospital or nursing home, but now they are looking at facilities which are much more convenient, much more safer, hygienic compared to what they were earlier. So that experience part of it, patient experience part of it, has also become very critical now. So unless you are able to provide a strong patient experience and that helps them to make and feel comfortable about the whole process, so it's very difficult to sustain that customer. So these aspects have changed. What I would consider changed post-COVID.
Right. So, Anand, do you think that the standardization of procedures have also evolved in the past 2 or 3 years? And what exactly has changed when it comes to standardization? And what I really also want to know from you is that how do you at SRL ensure the standardization of procedures when it comes to tier 2, tier 3 cities? Because you're a lab which is present across the country with hundreds of labs there.
Right. So Harbinder, so this, as you know, the laboratory has very limited or low barriers of entry. And we have seen that a lot of people have started labs over so many years. We have only 17% of the revenues in the organized sector. So there are more than 1.5 lakh laboratories across the country, where the processes may not be the same. So the importance of standardization and harmonization was felt much more during the pandemic because unless you have similar IT systems, unless you have integrated services, it's difficult for people to understand and interpret your reports. So the importance of accreditation, especially what the government of India's NABL does, the NABL is a autonomous body which gives the ISO 15189 certification for laboratories. So that also we saw that, because of the COVID, the awareness on this certification also increased because any COVID lab has to be NABL accredited. So that means, people got exposed to something called, apart from RT-PCR becoming a common word, we also found NABL becoming a very common terminology. So post-COVID also people are looking at, whether they should go to an accredited lab or not. So when they find an accredited lab, they would always prefer to go there and they are actually looking out for accredited laboratories. So the process of accreditations have increased and more people are now getting into that. And now NABL is also facilitating this process by starting a new campaign on, minimum level of entry. So they're doing an entry level NABL. So where, even smaller laboratories with lesser number of facilities can go into some process. So they can create some SOPs, some models by which, the safety, hygiene, convenience, quality, standard processes are all being ensured. So I think that's very important. And at SRL, since we have close to 400 laboratories across the country, and we operate multiple formats of laboratories. We have hospital laboratories, we have standalone global reference laboratories. So we have regional reference laboratories, we have stat laboratories or express laboratories, and we also have, smaller centers of collection. So you have collection centers across the country. So we have close to about 3,000 plus collection centers across the country. So what happens is, how do you ensure that the processes are similar everywhere? If you talk about NABL accreditation, we are probably the largest private chain, private lab chain with the largest number of laboratories which are accredited by NABL and College of American Pathologists, USA. So we have close to about 50 laboratories accredited in this process. But if you see our other laboratories, what we do is, wherever they are not accredited also, we follow the processes as per ISO 15189 standards. So this is critical, and we do internal audits. So we have our own internal audit system and internal quality control processes by which we make sure that, the similar practices and processes are controlled and, conducted in a similar fashion across, whether you go to a tier 2 city or a tier 3 city, or whether you get it done in Delhi, Bombay, Chennai, or Bangalore, you get the similar kind of experience and similar kind of reports. The quality of the reports will not be different.
So, Anand, what happens is, when you're looking at standardization, there's a standardization of procedures that are being followed, etc. But entirely also depends on the quality of people, especially the ones that represent you when they go and collect the samples from home, etc. Now, we know that, there's a challenge in terms of getting good quality manpower because the requirement is so huge. How are you managing that particular situation?
So that's a very, very important aspect of our, whole laboratory service, if you can say, because people are the most important resource, and they actually make or break the system. So you can put whatever processes in place, unless you have the trained human resources behind it, it's going to be very difficult, especially in this field, because it's about patient experience, and the touch and feel for the patient actually happens at the phlebotomist level, and also, at the level of, how the customer interaction happens when it is a call center or whether it is a front office. So apart from that, we also need the skilled manpower which is required to conduct the tests, and the pathologists and biochemists and all those scientists required to sign off and see those reports, interpret those reports for the doctors. So it's a very critical process, and manpower is definitely skilled manpower is definitely there's a scarcity of it, and we are working closely with many of the universities and institutions to actually look at sponsoring those students, some of the good students, as well as also looking at collaborating with them and creating short-term courses, skill development courses. We have collaborated with Delhi Skill and Entrepreneurship University. We have some association with Chitkara University. So we work with the University of Bombay by giving some PhD program and MPhil and MSc programs in biotechnology. And we also have, we are also recognized by, the Maharashtra University of Health Sciences to provide the postdoctoral fellowship program in, molecular pathology for doctors, because you can get pathologists, but how do you train them on the latest techniques? So it's important that they are all certified, they get postdoctoral certification. So for different levels, different types of certification. We are also now working on creating a short-term phlebotomy training program, so that we can get the rural youth to get into this process. So we are looking at how we can actually do it, how we can actually empower the rural youth into getting into these kind of systems, by following the procedures as well as requirements for healthcare, but at the same time trying to bring them into the mainstream of healthcare work.
That's really nice. I mean, that's brilliant that the activity that SRL is taking on. Anand, SRL has also moved into specialty tests, for example, cancer screening, etc. How has the journey been moving from generic tests to specialty tests? And what is the ratio of generic tests versus specialty tests that SRL is doing?
That's a very big movement that's happening currently as far as labs like SRL are concerned, because we have always been positioned as a reference laboratory for hospitals and nursing homes, and as well as for smaller laboratories spread across the country. So we even get references from other countries like South Asia and Southeast Asia, as well as from Middle East and Africa. So all these people depend on us for their requirements. And specialty testing segment is a very critical segment because those tests required specialized equipment. The technology is also growing and it's evolving and it's new. And the required manpower is also very scarce. So you need to get those people, train them, and have them there. And it's not possible for every lab to do it. So what we feel is that with renewed focus on next generation diagnostics. So what we are seeing is that as a genetics, genomics, proteomics, molecular pathology, digital pathology. So all these aspects combined with data-driven insights that are developed over the systems through artificial intelligence and machine learning. So these are going to be very important aspects, and these tests especially are very useful for oncology segments, as well as for some of the reproductive health segments, as well as for inherited disorders, neurology and other pediatrics, where there is a lot of scope for inherited disorders and inborn errors of metabolism management. So these tests are very critical for those. And these genetic studies today, we are seeing that there's a lot of screening as well as differential diagnosis happening on these aspects. And the tests for these diseases are very critical. And the doctors who treat the patients are very highly dependent on the test reports, and the quality of the reports and the advice of the pathologists and the geneticists is very critical for the treatment protocol that is going to be employed on the particular patient. And that is where what we call about as personalized medicine today. So earlier it was more of evidence-based medicine. Now we talk about personalized medicine. For each person, based on his genetic profile, based on his various aspects, we decide on what kind of drug will work for him and what will not. So this process of getting into personalized medicine actually requires precision diagnostics. And that is where SRL comes. And today, if you see the specialized testing as a whole is close to about 25 to 30% of our overall work. But if you see if you see the next generation diagnostics, which is the genomics, proteomics, and those kind of tests. So it's only about 2 to 3% of our overall portfolio is currently giving that volume. But what I feel is going forward, that is going to be an area of growth, because that is one area where we'll see a maximum growth. We are also currently seeing almost a triple growth compared to rest of the portfolio as far as tests from genomics and related areas are concerned. So I feel that is going to be a future for laboratory science, because as we move more and more into specialized testing, so as a reference laboratory, we'll be able to be a very important player in that segment.
So Anand, since you were talking about volumes, and since you are the business leader at SRL, we know that when we are looking at the growth of the business, it is apart from the quality that we need to maintain up and upskill the team, we also have to look at the volumes to make the business sustain and grow at a sustainable rate. Now, as a business leader, how are you maintaining the balance between the quality and the quantity at SRL?
So volume, as we all know, is very critical for any business, and especially in laboratory medicine, volume is very important, because you will be able to run tests, you will be able to provide services in a much better way, and you will be able to provide that last mile connectivity in a better way if you have volumes. For example, we always start working in laboratories in what is called as a modular model or a hub and spoke model. So, we have a test menu of close to about 4,500 tests. So these tests are not actually done at all the labs. So we have a hub and spoke model where, some of our hub laboratories will do maximum tests, and spoke laboratories will be doing more of, routine and emergency tests, which are required more urgently. But at the same time, how will you actually start a new test in a new location? That depends on the volume. So today, if I'm able to get that critical mass of number of tests, so I will be able to start that test in that particular location. So that way I'm benefiting the population in that place, because I'm able to give a faster turnaround time, because I don't have I have to wait for the report to go to Delhi or to Bombay or to Bangalore to come back with those specialized reports. So volume is a critical enabler in this whole process. But at the same time, we also know that there is a lot of capacity in the laboratories. So the advantage with the systems that we have today is that there is a lot of excess capacity, and capacity utilization is in the range of about 50 to 60% currently in most of our laboratories. So the volume growth is important for us, because that will directly help us utilize our redundant capacity. At the same time, it will help us, create more laboratories where we can add, do more tests. That's how it works.
Right. So Anand, one more aspect is that when you're looking at expanding the business, obviously you're looking at more locations that you can serve, geographic locations. Now, technology is coming and playing a very big role, because since now you have digital microscoping, etc., so you don't have to have a pathologist sitting in the lab in that particular area. How is SRL adopting new technologies, and what is the role that technology is playing in the growth of SRL?
Right. So SRL has one of the largest network of laboratories across the country, and we have probably the most equitably distributed laboratories across the country. So we're not specifically north focused or west focused or south focused. So we're sort of spread out. So this gives us the advantage of having reference service provisions across the country in different parts to various smaller districts and town headquarters as well. But what we also see here, is that when you talk about how do we use technology, so what has happened here is we have used digital pathology as one of the key enablers, both in hematology services as well as in histopathology services, by which today it's very difficult for us to get very high-end pathologists in all locations. But you need to report for each location. So this digital pathology or whole slide imaging, where you are able to capture the image of the slide, and a pathologist, pathology has gone into a lot of subspecialties, whether it is a neuropathologist or oncopathologist or osteopathologist, nephropathologist. So for different organs, there are specialty pathologists available today, and they specialize in that. And the doctors trust their reports rather than any general pathologist who's going to give them an opinion. Because the disease profile is also more complicated at this point of time. So it's important for us that, if you have an oncopathologist sitting in Delhi, and if you have a patient, you have done something in Bangalore, so I have to have an opportunity to immediately scan that slide and get the opinion from an oncopathologist in Delhi. Or if maybe the doctor there says that, I need to take an opinion from somebody in Mayo Clinic, or somebody in Cleveland Clinic, or there is a specialist pathologist in Germany who has to give an opinion. So all this becomes pretty real time, in the sense that I can immediately scan and send the slides to wherever the second opinion requirement is there, and they can report on it immediately, and we can get those reports. So earlier the process was you send the blocks all across the place. There is a fear of the samples getting lost, because they are very precious samples. You can't get those tumor samples once again. So samples getting lost, and then you don't know how long it will take for the reports to come back. So all those things, I think technology has enabled. And even within our country, we are trying to use technology to help not only in histopathology but also in hematology, where the peripheral smear slides are scanned, and they are reported from our hub laboratories. But there we still have some challenges, because there are some regulatory requirements, which says that you need a physical pathologist to sign out reports. In some states, there are some regulations. So you still can't do away with the local requirement of a pathologist. But technology actually offers you solutions where you are able to get those tests done in one location and reported from a different location, by actually getting the best minds in place, so that you're able to provide the best service for even for those remote locations. So I think that is very important today. Incidentally, yesterday we opened our center in Kargil. So, so that was a very interesting thing for us. So because just a month back, we started a lab on, started a center in Bangladesh border. So on the other side. So this one is in Kargil. And actually to see that, you are able to provide those services to the people in those remote towns and villages in that Kargil and Ladakh area. So the requirement you see there is huge. So for them, this actually, for us, we see plenty in bigger cities. So it may not be very, useful for us, but for them, they see the value, and they are very happy and welcome these kind of initiatives in those locations.
No, I think that's a brilliant initiative, because apart from serving the large cities and the semi-urban areas, these are areas where you can actually be very, very useful and be used by doing good. So congratulations on that.
Right.
So Anand, the business of diagnostics has transformed in the last couple of years. Traditionally, we've had somebody who goes to a doctor, and there's an evidence-based requirement of a test which is prescribed, and the doctor would tell you which lab to go to. Now we have people who are aggregating and acquiring customers online. So there's a complete paradigm shift in terms of how you acquire customers. How has SRL evolved over a period of time, and what is it that you do to acquire customers and retain them without compromising on the values of the company?
Right. So even today, what we find is the involvement of doctors is very critical in the prescription of tests. So what we have found is we have about 60% of the test prescriptions, the tests being done, are still being prescribed by doctors. So doctors play a critical role, and they actually decide on which lab they should go. They recommend some labs, and they also, suggest that if you get these tests done from these labs, it'll be more reliable for them to take a call on, because 70% of the clinical decision making is dependent on laboratory reports. And more so, in certain disease conditions where the patient is being monitored, when there is a prognostic or a therapeutic activity which is happening for the patient. So it's very important that he gets reports from the right lab. So with this, I think we find that the role of doctors are very critical. But at the same time, what we are also seeing is the preventive health segment, which is probably now at about 10% of our overall business across the spectrum, across all companies put together also, it's about 10%. So that segment is growing, and that is because the awareness of the patients are increasing about their health, and they are looking at various options to get themselves tested. So that segment is growing, where that also has got two different segments. There where some people who are looking only for value in terms of budgetary value, and there are some people who are looking at what exactly they need in terms of health. They want to have some quality services and all that. So here, if somebody is looking only for a pathology-based test, they would definitely look at value, and they will use their online aggregators, choose over the net. They will study and they'll make a choice. But mostly, as you know, health checkups is not just about pathology. It involves radiology. So you may have to get an X-ray done. You may have to have some ultrasound done. There is an ECG, echocardiogram. There's a stress test. So all these put together, along with a physician consultation, a cardiologist consultation, a gynecologist consultation in case of a woman. So all these put together only comprises a health checkup. So health checkup is not about doing about 30, 40 tests bundled together and, you're able to give an opinion. It actually gives a false sense of, being healthy, because, you were saying that, I did a master health checkup which had about 100 tests, and I have come clean on those 100 tests. So I'm now all good to go. So it's not like that. So it needs an intervention from a physician who's going to take look at your physical parameters, He's going to compare your lab reports with your radiology reports. He's going to compare and correlate your radiology findings and lab findings with what he sees in you as a person, your clinical signs, and then decide on and talk to you about your family history, counsel you, and then decide on what is good for you going forward. So I think the overall health checkup business, we shouldn't even be calling it as a business. So this whole thing is being trivialized if you actually try to do multiple things like, you say a heart checkup, a kidney checkup and all that. And you do some 10 tests and you know that your kidney is all right. So this is all, I think it is, it will not stand for a longer time because, it involves health of a patient. And we can't really guarantee a patient that, he's gone through a health checkup and, so he's not going to get the disease for next 1 year or 2 years. So I think it's an evolving industry. It's an evolving scenario now. And the patients are also experimenting with the choices they have. So I'm sure this will probably settle down in the next couple of years when they actually see real value in what needs to be done.
So, Anand, one of the critical things when it comes to diagnostics is the R&D. And most laboratories or diagnostic companies are not involved in the R&D, but we've seen a lot of new diseases emerging, new conditions which are emerging that have been researched. What is the role that a large diagnostic company like yours could play in R&D? And is there something that SRL does in this area?
That's a very, very important question, Harbinder, because R&D is so critical for laboratory science today. SRL has been one of the very early labs which had its own R&D department. And, we have been, through the R&D and academics division, we have been releasing knowledge, knowledge management, papers, like, we have been running monthly magazines for doctors. We have been doing weekly mailers to doctors. And we also done some patient informationals. These things are for knowledge dissipation. But on R&D front, we also, with academics, as I told you, we are running this PhD and, MSc, PhD and your fellowship programs. So, but apart from that, we also probably are one of the first labs to have a lot of lab developed assays. So in-house developed assays, what you call as homebrew or, lab developed assays. It's called lab developed assays. And, we have had a largest repertoire of lab developed assays, especially for various viral markers, various newer diseases, especially when you talk about TB, when you talk about hepatitis. We have developed our own kits during the last so many years, and we still continue to do that in our way. And recently we also developed a protocol for monkeypox screening. We got the test ready, but we were not able to get the government's go ahead because the government was more on doing it in the public ICMR labs. They were not really coming out on whether private labs should do it. So meanwhile, we had also developed a sequencing protocol for COVID. Even that, they were not allowing most of the private labs to get in at that time. So the R&D work keeps going on, and it's very important, mainly because if you see in countries like US, the almost 50% of the tests that they do now are all lab developed assays. So those are actually developed in the lab, and then they are certified by FDA, or there are CLIA routes. There's something called a CLIA route, Clinical Laboratory Improvement Amendment route. So by which, the test gets accredited and that test gets used in the laboratory. So similar processes have to evolve in India as well, in terms of how do you approve and validate a test, and then insurance pays for it, so that more and more tests gets developed within our own country, in our own laboratories. So we can bring down the costs of these tests as well as the availability of these tests, because today for many lab developed tests we need to send it across to some of the labs in Germany or in the US. So instead of that, we can also develop and start those tests here. So I think that is one very important aspect which we continue to focus on, in terms of generating more lab developed assays and getting them validated and being used clinically, proven methods to be used for day-to-day practice. That is something which is very important for us to look at.
So Anand, since you brought up the word government, my next question to you is how important is the public-private partnership model in the field of diagnostics? What is the role of PPP and what impact do you think can be created if there's a strong PPP model that comes out?
Yes. So as we all know, Harbinder, that almost 70% of the healthcare requirements are being provided by the private sector in the country, and almost 80 to 85% of the healthcare spend is out of pocket. And with 70% of our population also living in semi-urban and rural areas, so it's important that we have a sort of a collaborative model between government and the private sector in terms of providing services for healthcare. And laboratory is no different, because laboratory is probably the first line of defense in many of these diseases. And many of the common diseases that we see in cities, we also see a much larger gamut of such diseases in the rural and semi-urban areas, because there the community-related diseases, which are the communicable diseases, and the non-communicable diseases, both are available in those areas. So it's very important that the burden of disease in those territories are very important to be tackled in a better way, and public-private partnership is sure way for that. And district level hospitals, block level hospitals, having public-private partnership where the laboratories are managed by players like SRL will be very useful. We have done a model, similar model in Jharkhand. We have recently completed a model in about 8 years. We have run for Himachal Pradesh. So those are very important aspects of growth, and I feel government and private sector should collaborate so that we are able to bring the best of healthcare to the population at a very affordable and low cost. So that is most important, because the public sector actually brings together the people and gives the volume, and the private sector is able to bring in the technology and the latest requirements for healthcare and the protocols around it. So blending these two, we are able to make a sustainable solution for healthcare. So where you're able to offer affordable choices to patients who are actually not just below the poverty line, but also on the fringe of APL and BPL. So those are very critical mass of people whom we need to cover.
So Anand, it is not easy for just any diagnostic company to keep expanding in different geographic areas, keeping in mind that every geographic area has its own set of disease conditions or the disease burden which is there. Despite that, SRL has been growing and expanding not just in India but overseas as well. You've set up labs in Dubai, Nepal, Afghanistan. You just mentioned Bangladesh as well. Are there more expansion plans overseas?
Yes. So we have our own lab in Dubai, and with that we cover the entire Middle East. So we have some facilities in Oman and all that where we help set up. So, and we have multiple collection centers, and we work with many hospitals and laboratories in the African continent as well. So we have our plans is to expand more on our specialty menu in terms of getting samples for specialty testing from African countries, mainly East Africa and West Africa, and also from the CIS countries, in the Asia and larger Europe, those kind of areas. So that is one important aspect. We also are focused more on South Asia, and Southeast Asian countries in terms of getting specialized work. So currently we work on management models, hospital lab management or standalone lab management models, as well as working on collaborative models with local healthcare players in these countries so that we can set up these things. We are also exploring some public-private partnership opportunities in some of these countries where the governments are coming ahead and trying to work with the private sector in providing certain services. So especially in some of the countries in the CIS region, one or two in Africa, And there are also some opportunities in the Middle East where the government is, the Ministry of Health in many of these countries are looking at collaboration with private players.
So Anand, how big is the market size for diagnostics in India, and what percentage of the pie is with SRL? And with the newer players coming up in the market, what is your growth strategy for SRL?
Right. So I think the size is somewhere around 60,000 crores is the size of the diagnostics market. So out of that, probably about 15 to 16% is in the organized sector. And we are at about 1,600 crores last year. So you can imagine, so we're such a small player in terms, maybe 1.52% of the market is with us. So there is a large scope for expansion. There are two things which are happening here. One is, there is a move from, there's a consolidation, there's a move from unorganized to organized because of greater awareness being created. So there is a definite shift in consumer behavior, which is actually moving business from unorganized to organized. And the other thing is, in the unorganized sector, the players who have reached some scale, so they are also looking at opportunities to collaborate. So we are exploring a lot of mergers and acquisitions opportunities as well in this space. We hope that these things also will continue. Both smaller as well as larger acquisitions will continue in the next 2-3 years, by which there will be further consolidation in this space. We are also seeing the market expanding, as we know, with healthcare awareness going up. So we are also seeing the market expanding. So the pie is growing bigger. So we have more players, but at the same time, the pie is growing bigger. And we are all more focused in the tier 1 and metro kind of cities. So there is a large opportunity waiting for us in the rural and semi-urban India. And I think those opportunities are also being explored by us. And that is where the larger growth will come from when we expand our, we have created a network now. So it is now to push and further expand on this network and bring more samples into this network.
Anand, since you spoke about partnerships and collaborations, etc., SRL some time ago partnered with Roche, right? Can you share more about what this partnership is all about, and are there any more such partnerships on the way?
Yes, so we are actually looking at how we can partner with various in vitro diagnostic companies, as well as with some of the laboratory services providers in other countries as well, so that we are able to provide the best services for the people whom we serve in India. So we had done a partnership with Roche, especially to set up integrated platforms for laboratory services. We had actually looked at how we can improve our workflow and processes, and getting the AI and ML driven processes to be put in place, so that our overall workflow and efficiency improves in our laboratories. So that is one model which we have worked with Roche on that. And we are also working with them on some projects where we are able to create some cervical cancer screening programs using their technology that they have. So that is another model that we are working on with them. So similarly, we also have a partnership with Mayo Clinic Laboratories in the US, where we are able to provide some of the very critical testing requirements which are not available in India through their laboratories. And we are also looking at technology transfer in terms of any newly developed assay there, that if we can build it and have it done in India itself. So our teams get trained on how that technology can be used in India, and then we go ahead and implement that in India. So those processes are also on.
So Anand, my last question to you, and it has got two parts. One is, as a CEO, you have a busy lifestyle. I'm sure there are a lot of pressures of all kind, leading to anxiety, etc. So my two parts are: one, what is the most important lesson that you have learned as a CEO in the corporate world? And the second part is that what is it you do to de-stress yourself? What are your hobbies? What does Anand as a person do in his personal life, enjoys doing it in his personal life?
Right. So I think as a CEO, it's very important. What I find is, especially in a company like SRL, where we have about 400 odd labs spread across the country, and we have close to about 7,000 employees. So it's important for us to listen to the last employee who's there on the ground. So I think keeping your ear to the ground is very critical, and continuously keep listening and keep talking to people within your company and as well as outside at the ground level is going to be very, very important. So I think just sitting with the board members or having your own executive committee meetings are not going to help. So it is your ear to the ground approach which is going to help, and that has always helped me and keep me on top of things when it comes to what happens on the ground, and take decisions based on what affects the last person who's with the patient. So that is where the change has to be brought about, and that is where I think the whole process keeps evolving. That is what I would say on the first part of your question. On the second part of your question, yes, there's de-stress. Yes, I have a dog at home, so I spend a lot of time with that, and I read a lot of books. So, so that is something which I do to keep myself busy when I'm not, working on the projects that I have in hand.
Oh, that is really, really awesome. Anand, I really thank you for taking out time to speak with us. It has been such a meaningful conversation. And I love the last part where you say that, you keep your ear to the ground approach to enable quality decision-making and grow the company. Thank you so much for taking our time, Anand. It has been a pleasure.
Thank you, Harbinder. It's always a pleasure to interact with you. And thank you so much for this opportunity.